Are you taking Amlodipine, Verapamil, Valsartan, or Chlorthalidone for high blood pressure? Then what you're about to hear today could be one of the most important health messages you've heard this year. Have you noticed swollen ankles, unusual fatigue, dizziness when standing up, muscle weakness, a racing heartbeat, or even unexplained trips to the bathroom at night? Many seniors assume these changes are simply part of getting older, but in some cases, they may be your body's way of reacting to your blood pressure medication. I'm Dr. Aliza Wright, and in today's video, we'll uncover the hidden side effects seniors should watch for when taking Amlodipine, Verapamil, Valsartan, or Chlorthalidone. We'll explain which symptoms deserve immediate attention, which ones are commonly overlooked, and what every senior needs to know to stay safe while managing their blood pressure. Make sure you stay until the end, because one warning sign that many seniors dismiss as harmless could actually be a signal that your body needs medical attention. Before we begin, please subscribe to our channel for clear senior health guidance that protects your heart, independence, and peace. So by the end of this video, you're going to know the 11 things seniors must understand if they take Amlodipine, Verapamil, Valsartan, or Chlorthalidone. But more importantly, you're going to understand the number one thing that makes these drugs dangerous when it's missed. And no, it's not some rare reaction buried in tiny print. It's a mistake in interpretation, a thinking mistake. The kind that causes people to sit at home believing everything is fine while their body is already sending a clear message that something needs attention. Let me start with Gloria, because her story reveals mistake number 11, and it's one I see constantly. Gloria was 72, organized, responsible, and proud of how carefully she followed doctor's orders. She took one of her blood pressure pills exactly as prescribed. Same time each day, never skipped it. When her daughter asked if she knew what the medicine actually did, Gloria laughed and said, "It lowers pressure. That's all I need to know." But that answer turned out to be the beginning of the problem, because when side effects started, she had no framework for recognizing which medicine might be causing what. Mistake number 11 is taking a blood pressure medicine without understanding its personality, without knowing what kind of effects belong to that particular drug. Amlodipine is a calcium channel blocker that mainly relaxes and widens blood vessels. Verapamil is also a calcium channel blocker, but unlike Amlodipine, it can slow electrical activity in the heart. Valsartan is an ARB, which blocks a blood vessel tightening hormone system. Chlorthalidone is a diuretic, often called a water pill, and it pushes extra salt and water out through the kidneys. Those differences are not trivia. They are the map that helps you notice danger early. When Gloria developed ankle swelling, she thought it meant her heart was failing, and she panicked. But she was on Amlodipine, a medicine known to cause swelling in the ankles, feet, and lower legs in some people. That doesn't mean swelling should be ignored. It means swelling has to be interpreted correctly. If she had understood the drug's personality, she would have known this side effect belongs in the conversation with her doctor right away, not in a lonely spiral of fear at home. And that's the first lesson. A medicine you do not understand can't warn you properly. Now let's move to mistake number 10, because this one sounds harmless until you see the consequences. Harold was 76 and took his medication faithfully. But if he forgot a dose in the morning, he'd make up for it at lunch. If he forgot at lunch, he'd sometimes take it later in the evening. If he thought he might have missed one altogether, he'd occasionally take an extra tablet just to be safe. He figured a blood pressure medicine wasn't like pain medicine or antibiotics. He assumed a little variation couldn't matter very much. That assumption nearly dropped him to the floor. Mistake number 10 is getting casual with timing, doubling up, or improvising after a missed dose, especially with medicines that change blood pressure, fluid balance, or heart rate. These medicines work best when the body experiences them consistently. Amlodipine is generally taken once daily around the same time. Verapamil may be once or twice daily, depending on the form. And extended-release versions have to be handled exactly as directed. Valsartan is taken at regular times, often once daily for hypertension. Chlorthalidone is commonly taken in the morning, often with food. When seniors start guessing instead of following the schedule, blood pressure control becomes unpredictable. Harold's trouble came after he doubled a dose because he thought he had forgotten it, and then stood up from his chair too quickly. His vision dimmed, his legs weakened, and he barely caught himself on the table. That near fall was not bad luck. It was a predictable consequence of treating a prescription like it was flexible. The rule is simple. If you miss a dose, do what your medication instructions say, or call your pharmacist or doctor for guidance. Do not create your own correction plan. With these medicines, guessing can be just as dangerous as forgetting. Mistake number 9 is taking chlorthalidone as if the time of day doesn't matter. And I need every senior on a water pill to hear this. Martha, age 70, took her chlorthalidone with dinner because that's when she remembered most of her pills. For a while, everything seemed fine. Then she started waking 2, 3, sometimes 4 times a night to urinate. She became exhausted. One night, she stood up in the dark, turned too quickly, and slammed her shoulder into a door frame. She blamed age, nighttime vision, and maybe a little clumsiness. But the real problem was sitting in the pill organizer all along. Chlorthalidone helps lower blood pressure by making the kidneys remove extra salt and water, which is exactly why late dosing can create miserable nights and dangerous mornings. More urination can mean disturbed sleep, dehydration, weakness, and a greater fall risk when you're tired and unsteady. This medicine can also cause dizziness when you stand up and may contribute to low potassium or other fluid shifts, especially if you're sick, sweating heavily, or not drinking appropriately. That's why morning timing matters so much. A pill taken at the wrong time can turn a useful treatment into a setup for nighttime injury. But here's where Martha's story gets even more important, because the nighttime urination wasn't the only clue. She also had dry mouth, leg cramps, and a strange washed-out feeling by late afternoon. Those are the kinds of symptoms many seniors call just one of those days. Yet with chlorthalidone, thirst, weakness, cramps, nausea, or unusually deep fatigue can be the body hinting that fluid or electrolyte balance is off. And if vomiting, diarrhea, or hot weather enters the picture, that risk can climb fast. A senior who ignores those clues can go from a little off to truly unstable before dinner. Now, mistake number 8, and this one belongs to amlodipine. Leonard was 69, active, and newly started on the medication. Within a couple of weeks, his shoes felt tighter by evening. He noticed sock marks around his ankles, and his lower legs looked puffy at night. He did what many seniors do. He decided it must be too much salt, not enough walking, maybe warm weather. He kept saying he'd mention it sometime. But then he added something else to the picture. He became more tired, occasionally lightheaded, and once felt his heartbeat pounding after climbing the stairs. Mistake number 8 is ignoring swelling, palpitations, or new dizziness on amlodipine because you assume the medicine is mild, or because swelling doesn't seem urgent. Amlodipine is effective and widely used, but it can cause swelling in the hands, feet, ankles, or lower legs. It can also cause flushing, headache, tiredness, dizziness, sleepiness, and in some people, a fast or more noticeable heartbeat. Very rarely, serious symptoms such as fainting, irregular heartbeat, or worsening chest pain need urgent attention. The biggest error is not the side effect itself. The biggest error is failing to connect the side effect to the drug. Leonard waited too long, and by the time he called, he had spent days worrying that his heart was failing, while also assuming nothing serious was happening. Both thoughts were wrong. The correct move with swelling on amlodipine is not to panic and not to ignore it. It is to report it promptly, especially if it is new, worsening, or joined by dizziness, chest discomfort, or fainting. That middle path is where safety lives. Seniors suffer when they swing between two extremes: terror without understanding or calm without caution. What you need is informed attention. Mistake number 7 is one of the most overlooked medication traps for seniors, and because it hides in the kitchen. Eleanor loved grapefruit at breakfast. She had eaten it for decades and saw it as one of the healthiest parts of her day. When her doctor prescribed Verapamil after a rhythm problem and blood pressure issues, she never thought to ask whether fruit could matter. A few weeks later, she was more dizzy, more sluggish, and more constipated than usual. She thought maybe she was coming down with something or simply slowing down with age. But the problem was not aging. It was interaction. Both Verapamil and Amlodipine come with a caution about grapefruit or grapefruit juice, because grapefruit can increase the chance of side effects. That matters enormously in older adults, who often have less reserve to absorb extra dizziness, fatigue, or blood pressure lowering. Verapamil also interacts with other medicines and even certain herbal products, and alcohol can hit harder and last longer while you're on it. So when a senior says, "I only changed breakfast," or "I only added an over-the-counter product," I pay attention. The body does not care whether a problem came from a prescription bottle or a fruit bowl. Eleanor's case leads directly to mistake number 6. And if you're on Verapamil, this part matters more than you may realize. Verapamil is not just a blood vessel relaxer. It also slows electrical activity in the heart. That's one reason it can help with certain rhythm problems and angina. But it's also why seniors must never shrug off symptoms like a very slow pulse, fainting, unusual exhaustion, or new shortness of breath. Those are not senior moments. Those are cardiac clues. And the body often whispers them before it shouts them. I remember Walter, 74, who said his biggest problem on Verapamil was just constipation. And because he felt embarrassed, he focused on that and said very little about the rest. But when I kept asking questions, the whole picture emerged. He was more tired walking to the mailbox. He had one episode where he had to sit down suddenly after standing. And his pulse, when he finally checked it, was slower than usual. Verapamil can cause constipation, yes. It can also cause dizziness, headache, heartburn, slow heartbeat, swelling, and in serious cases, fainting or trouble breathing. The constipation was real. It just wasn't the only thing happening. Mistake number 6 is assuming the most annoying side effect is the only side effect, especially with Verapamil. Seniors often anchor on the symptom that feels easiest to explain. It's just my bowels. It's just fatigue. It's just poor sleep. But Verapamil demands a wider lens. If constipation arrives alongside dizziness, weakness, swelling, blurred vision, or an unusually slow or irregular heartbeat, the story changes. This is exactly why understanding the medicine's personality matters. A drug that slows the heart can create a very different danger pattern from a drug that mainly causes ankle swelling or increased urination. Now let's talk about mistake number 5. And because Valsartan has its own quiet danger, and it often comes disguised as something healthy. Raymond was a disciplined man, careful with salt because he wanted to protect his blood pressure. So he switched to a salt substitute. He also had arthritis and took ibuprofen on rough days without thinking much about it. He was on Valsartan, felt mostly fine, and assumed he was making smart choices. Then he became more lightheaded, less hungry, and strangely weak. He noticed he wasn't bouncing back the way he usually did after minor illness or hot weather. Mistake number 5 is forgetting that Valsartan changes how your body handles blood pressure and potassium, so the little things around it matter. Salt substitutes that contain potassium can push potassium too high. Potassium supplements can do the same. NSAID pain medicines